intern feedback workshop for 2026. I hope you can hear me well. And let me start by apologizing for the delay. We should have started. Already at 9 o'clock, so we are 10 minutes late, and my apologies for that. It's like there is an echo. Let me continue. So today we are having our first intern. Okay, I'm hearing an echo, but let me try to continue. So I was saying this is our first feedback session for 2026, and the purpose of this session is just to share assessment experience with interns, to guide them on what they need to do in order to improve and be successful in the portfolio of evidence entries that they are submitting. So there are a few house rules that I want us to take note of before we start. Maybe let's move on to the welcome slide, please. So from our side, the first thing that we are saying to interns is that this session will take 3 hours, and we're encouraging you to stay with us until the end so that you get all the info break of 15 minutes from 10 hour 30 to 10 hour 45. And the other thing that you must note is that there is a presentation that has been uploaded on the website, and interns were requested to go through it as a way of preparing for this workshop. So I hope you manage to go through it, because that will allow you to follow with the discussion that we're going to have. So today's session, we will be doing less talking, and mostly we will be doing case studies wherein we will be taking you through on what is it that you need to look out for, and also to help you interpret the assessment comments. So that's how we're going to approach it. So there will be about 5 case studies. If time allows, we will go through them all. If not, we'll go through whatever number we could cover. And each case study is taken from one of the 6 domains. So we'll be working on those case studies, and these case studies are the actual entries that were previously submitted by interns. So we have requested these interns to use their entries for this discussion, and they have given us permission to do so. And we want to thank them for allowing us to do this training with their entries. And then the other thing that you must also take note of is that you will be allowed to ask questions after each case study. So please, as you are listening to the case study being presented, if there are questions, please submit them using the question and answer function on Teams, or the comment section if you are joining us on YouTube, so that when we are done with the case study, we can attend to all your questions. And towards the end of the workshop, there is a survey. Please complete that survey, because we're going to use it as a proof of attendance for this workshop. You are also welcome to rate the workshop, because that will assist us to improve in future. And with those few words, I just want to encourage you to stay with us, and I'm going to hand over to my colleague to take us through Over to you, Prof. Thank you.
Morning, everybody, and thanks for being here. Thank you, Tabang. So, my name is Professor Neelavani Padiachi, and I will be guiding you through the first few slides, and we'll do a case study as well. But just to give you an overview of what the session entails, so we're going to do why do we have the session. Obviously, Tabang has given you some guidelines around why we're doing this and what the basis around this particular session is, the structure of the presentation, the way forward, and then we have Q&A. But remember, the Q&A would follow after each of the case studies that we're doing. And we'll start with the case study 5.3, competency standard, sorry, 5.3, which is, from our statistical analysis, one of the most problematic competency standards that we have. So therefore, we chose to go with that one first. Um, Rihanna, can you just change slides? Thanks. Followed by 4.6, which we'll have a case study as well, and then 3.4. And then hopefully, if we have sufficient time, we'll do two more. So while we're having this session, February, March, the intern tutor training session is really content heavy, and it involves a lot of information over a 3 hour period, which can be overwhelming. And particularly if you're doing CPDs for the first time in your internship year and didn't have the opportunity to do it in your undergrad, it becomes really overwhelming. So that session is really just an introduction of what we require as assessors and moderators, and how we guide, how we expect you to respond in terms of all of the CPD entries that you submit. It's difficult to see the relevance before actual involvement with the portfolio of evidence. So it really is challenging to, provide from our perspective as well, to be able to provide you information, particularly if you haven't done any of the entries as yet. So the best way to learn is actually to do. So therefore, this session hopefully will provide some insight. Now that you have conducted and provided evidence towards your CPDs and you have been assessed already, it'll give you some insight as to where you went wrong. So you are familiar with the system, you're familiar with the format, the competency standards, the domains, the various steps within a CPD cycle, for example. So you are au fait with all of that, and hopefully this will be a very rich discussion today. I know also you would have received feedback from your assessors. So the structure of the presentation is linked to the 2026 Intern and Tutor Feedback Workshop presentation slides, which have been uploaded on the Pharmacy Council website. And my colleague has done a voice over that presentation, which would also give you further insight into some of the areas we found as assessors and moderators that were challenging, some of the areas that you failed in terms of not providing sufficient information, potentially evidence as well, maybe not understanding the assessor comments, whatever the reason may be. But if you haven't had the opportunity to listen to that presentation as yet, please can you do that? It really is insightful and has a wealth of information. Um, and it would have been ideal for you to have listened to it prior to coming to this session. But if you haven't, I think you still will find the session very valuable. Portfolio of evidence entries are provided as case studies for discussion. So, as I mentioned earlier, we're going through a series of um, competency standards where we're going to discuss each one and highlight some of the challenges that we find as assessors and moderators, and hopefully guide you in understanding what we require. The PO, sorry, Rihanna, go back. Portfolio of evidence entries are examples of submissions from interns as well as students. So the examples come from both interns and from students. Additional confidentiality measures were applied. So you'll see when we're going through some of the pieces of evidence.
Sorry, Benny, I cannot hear you anymore.
Okay, I'm not sure why. Can you hear me now, uh, Rianda? Rianda now?
We can hear you, Prof.
Oh, thank you. Um, yeah, so confidentiality is really, you'll see as we go through the pieces of evidence, we've had to block out some of the details, but that was purely because it was evidence that was provided from interns and students, and to protect their identity, we had to do that. But in terms of each of the pieces of evidence, we would then highlight what should be blocked out and what should not. So just be aware of that. Interns and tutors are encouraged to participate, please. So we would appreciate if we have feedback from both interns and tutors. Thanks, Rihanna. Next slide. And then next slide. Glenn, I think Rihanna is unable to hear me. Thank you. Thank you. So we're going to begin with the first case study. But before we begin, I want to just to give you some insight and ask you a question. Would you want to be treated by a healthcare professional who has stopped learning after graduation? And I think it would be a resounding no from all of us as healthcare professionals, because we want to be kept up to date and we want to meet a professional who is knowing what's current in their environment, in their professional environment. So I think that it's important for you to understand why we do CPDs. And I think one of the things we've noticed as assessors and moderators is that sometimes interns treat this as a tick box exercise. And to understand that the purpose of a CPD is not really just about collecting documents, it's about identifying weaknesses, it's about improving competence, applying learning, and evaluating your own growth. So just bear that in mind as we go through this process, and try not to treat it as a tick box exercise. It really is just to improve yourself as a professional and to demonstrate reflective professional development. Um, so one of the things that we as assessors and moderators use as our Bible, as our guideline, as our fundamental core in terms of how we assess is this assessment criteria grid. And this grid is found in your intern tutor manual. If you haven't seen it before, please make sure you go and have a look and find it. I would recommend that you have it next to you every time you do a CPD. And it, as you can see, it gives you each of the steps. So step one, reflection, step two, planning. And it tells you what are we looking for as assessors and moderators in order to deem you either not yet competent or fully competent, which is number three, which is three. So each of that steps, I'm not going to go through this in detail, but we have done this in depth in our first workshop, and Rihanna's covered it a bit in the presentation that's online at the moment. So please take the time to understand this grid, because it really is exactly how we assess and moderate you. Next slide, Rihanna. That's the next steps in terms of the implementation. Step three, step four is your evaluation. Again, I'm not going to go through too much detail here, but you can see each of these steps within the cycle has a mark allocated, mark range, meaning if you have three, you would be fully competent. If you have zero, you're not yet competent. So when we're looking at for pieces of evidence, for example, for evidence, we're looking at valid, authentic, current, sufficient. It must meet 75% of the behavioral statements. It must be annotated. It must show the behavioral statements and how it is satisfying those behavioral statements. So all those components need to be identified when you're providing evidence in order to deem you as being fully competent. So just to give you an idea. But I'm sure you're all familiar with this already. And as I said, if you're not 100% sure, go back to the intern workshop that we've done in the beginning of the year, and Rianda's voiceover as well, which will guide you. Thanks, Rianda. Next slide. Okay, so we now are going into the nitty-gritty of the case study. So as I mentioned earlier, we're starting with professional and personal practice, which is domain competency 5.3. And this particular domain is ethical and legal practice. So if we look at the steps, so this is an actual submission from an intern. And if you look at the first one, which is on the left block there, is your learning title. And this intern had said, learning how to implement ethical and legal practices in the pharmacy. So the way I'm going to do it is I'm going to read through each of the steps, and then we're going to go through what are the things that are missing. And I'd like you to just take a moment to reflect how you would have approached this and what you would have thought before we even get to the next slide. Identify what you think is missing, and link that to the grid that I just showed you. Remember, based on what we look for in each of the steps in order to be deemed competent. So the learning title, it says learning how to implement ethical and legal practices in the pharmacy. And then what triggered my learning need? While working in the dispensary at this particular pharmacy, I encountered a Schedule 4 prescription and realized that I needed to better understand the legislation surrounding ethical and legal practice in order to handle such prescriptions appropriately. The learning need, I want to become comfortable and competent in dispensing and handling prescription medicines in an ethical and professional manner. And what I hope to achieve, I need to familiarize myself with the responsibilities and expectations associated with working in the dispensary. So, if we look at each of these areas, so we know in terms of what we require in the assessment grid, if you look at reflection, and before we go even go to the next slide, so your learning title must not be a direct copy of the competency standards. So it should not even include ethical and legal practices in the title because that is the name of this particular competency standard. Um, in terms of the reflection or learning need, it must be a clear learning need according to the competency standard and associated behavioral statements. It must provide a trigger scenario. So, what triggered this particular scenario? Why do you need to have that learning need or learning? Why do you think there's a gap in your learning in terms of what scenario you encountered? And an indication of what the intern hopes to achieve. Okay, so you can see that the titles are there, but then you have to question in terms of whether the depth is there. And that's our next slide. We're going to explain to you what we as assessors and moderators will look for. And these are the questions you need to ask yourself as well. So if we look at the learning title, and these are the assessor and moderator comments that came from this particular submission. So step one, learning title. The learning title is vague and not clearly aligned to the learning trigger. So it really is very broad. If you look at the title, and you should ask yourself, is it specific enough to be able to tell somebody prior to them even reading your reflection whether it has encompassed what you're going to learn within this particular competency standard? And if we look at that particular learning title, it wasn't really clear. It didn't give us enough depth in order to say, okay, this is exactly what this person's going to tell us in the next few steps. So the learning title must be relevant to what you need to achieve in ethical and legal practice. It must be more specific to what you will be doing. Learning title should not be a direct copy or similar to the competency standard or to the behavioral statements. So that's make sure that your learning title is comprehensive. It's not too long as well. Length is also really important. It must be concise but very clear as to what that competency standard is going to be in terms of your learning need. So looking at the learning needs specifically, competency 5.3 goes beyond dispensing. And you could see from the description of the reflection, there was a lot of mention around dispensing. And my colleague Adele will go through a dispensing with you, but you'll see this particular competency standard does not deal, yes, it does touch on dispensing, but the overall competency standard is around ethical practice and legal practice. So be aware of nuances like that, where you sometimes skew what your learning need is based on maybe just one behavioral statement within that competency standard. It is not just about dispensing. The learning need should be described sufficiently and align with the skills associated with the behavioral statements. That is how to apply relevant regulations. So one of the things that we also come across often is that we find that the intern does not necessarily read the body of what or the context around what this particular competency standard requires. Now, if we had to go back and look at the manual and look at the behavioral statements and read what the description of this particular competency standard is, it's quite intense in terms of what it requires from a legal perspective. And if I had to sum it up, I would say that this particular competency standard looks at ensuring that the pharmacist practices legally, ethically, and professionally. And how they do this is to comply with pharmacy legislation, recognizing their own professional limitations. So that relates to your scope of practice, maintaining competency, and adhering to the code of conduct and ethical principles. So that embraces all of the behavioral statements within this particular competency standard. So that's something we see where the learner or the intern will sometimes just focus on one behavioral statement instead of looking at that competency standard as a whole. So be careful and be aware of whether you're doing that or not when you are writing up your reflection. So it must be described sufficiently in line with the skills associated with the behavioral statements, how to apply the relevant regulations. Remember, you need to understand, and as I said before, the competency standards are here to show us that you are actually able to apply or you're able to work within an environment in a professional way. And applying relevant regulations is one of the ways of expressing how you are conducting yourself professionally. You need to provide a very specific learning need. So, what aspect of a dispensing of a scheduled medicine specifically are you unfamiliar with? So, is it looking for example, the authenticity or validity of the prescription? Are you unfamiliar with that? Is it in terms of maybe a fraudulent script? What do you do and how do you approach that? What does the legislation say? Are you allowed to dispense it? If you do dispense it from a code of conduct perspective, ethical rules perspective, how would you approach it? What is the implications of that if you do dispense it? So those kind of learning or thinking we'd like to see from our interns. What skills or knowledge do you hope to achieve after addressing the learning needs? So once you've identified your gap, why you want to do this particular competency standard, now you need to tell us, so what do you at the end of this, what do you hope to achieve? So you could say, I want to learn how to dispense a schedule 6 prescription, or I want to learn how to in terms of a schedule 6, which is one of the most common examples in this particular competency standard, all the areas around a schedule 6 prescription, what you'd like to learn. And then future learning need is quite vague and is not really related to the learning need or competency standard. So also the future learning need is also something we find as interns you don't express clearly enough. Um, and perhaps have a look at, how do you express yourself better when it comes to what you want to learn in the future. Okay, next slide. So, planning, from my experience as a moderator marking, I find planning to be very challenging, and often interns don't are not comprehensive in their description around planning. So, in this particular submission, the interns have said, firstly, I plan to refer to the scope of practice for a pharmacy student, but remember, you are acting as an intern, and this is a student example in the Good Pharmacy Practice Guidelines, Chapter 3, Section 3.9, to confirm that dispensing Schedule 4 medicines falls within my scope of practice. I will also study Section 22A of the Medicines and Related Substances Act of 101 of 1965, along with the amended General Regulations of August 2017, to understand the legal requirements for dispensing Schedule 4 medicines. In addition, I will review chapters 13 and 34 of the Pharmacy Act to familiarize myself with the legislation regarding registration. To ensure I meet professional indemnity requirements, I will consult chapter 3, section 3.5 of the GPP. Finally, I will study sections 1.2 and 1.4 of the Code of Conduct for pharmacists to ensure that I uphold the ethical principles expected of me when handling Schedule 4 prescriptions. My goal is to dispense Schedule 4 medication successfully. So here, when it comes to the planning, remember we want to be able to see your reasoning. So you have to be specific as to what the expectations are as per the grid. So Again, align to the grid, know what we want, align it to the behavioral statements. Tell us the reasoning as to why you're using that particular resource. Be specific on the sections within that particular resource that you are providing, like chapter number, page number, etc. So this particular planning section was not met. And the reasoning and the comments from the assessor and the moderator is what is the reasoning behind the use of the resources you mentioned? And you'll see some of the reasons are there, but we need all of the information to be provided. So you must tell us more detail as to why you're using that particular resource. And how does it align to the behavioral statements? So, if I'm not mistaken, I think this particular one has five behavioral statements. So, we want to see how you're linking. How does GPP or code of conduct, for example, relate to the behavioral statement? Which behavioral statement are you linking it to? And if memory serves me right, I think it's the last one. I think it's E for this particular competency standard. So if when you're mentioning code of conduct and ethical rules, in brackets, you'll say behavioral statement E, close brackets. So then, and you must reflect at least 75% of the behavioral statements that are linked to some form of planning. And then we understand, okay, this is your reasoning, this is your planning, this is how you're going to achieve these behavioral statements to show to us that you are competent. Outdated legislation. So that's something we also see happen quite often with our interns is the use of old legislation. Now remember, one of the biggest things as a professional, as a pharmacy profession, you need to keep updated with every single current legislation change that has happened. And you cannot argue that or say that you didn't know. You need to keep updated, keep abreast, and that's part of your CPD. So the fact that you're using an old piece of evidence, a piece of legislation, shows or reflects to the assessor and the moderator that you're actually not keeping up to date and you are not competent in terms of what you are trying to achieve. Pharmacy Council website is really a fantastic resource of information because all of the information there is current, it's updated on a regular basis. It gives you information to the Pharmacy Act, to the current legislation around board notices that have changed. The scope of practice is there and it's the current scope of practice. So you'll see the example that was used here for this particular submission was an old scope of practice. The scope of practice just recently changed, I think within the last year and a half or so. So it's important that you keep up to date. So immediately that is a failing, and it's important that you keep up to date, and that wasn't accepted. So how do you plan to practice within your scope of practice is also important to tell us how do you plan to do that. Which part of Section 22A do you intend to apply? And Section 22A is really an important piece of legislation. It really deals with a multitude of things. And we'd like to see more specific. So, how is that Section 22A going to help you with this particular competency standard? And which behavioral statement is it aligning to? So, you're going to achieve what you say you're going to achieve by using this particular piece of legislation. In terms of your regulations, so which regulation within the Medicines Act deals with the authenticity and validity of a script? What other regulations do you plan to use for the rest of the dispensing cycle? So remember something like your good pharmacy practice where you talk about the phases of dispensing and then you align it to the behavioral statements. There's also no planning for behavioral statement C. Just trying to remember what behavioral statement C was. So C was keeping abreast of legislation. So it was quite evident that there was no link to that. And also the fact that the person used an old legislation immediately makes that not yet competent. And then please always try to remember to cross reference to the behavioral statements in your planning. Implementation is step 3. So remember, implementation is done in combination with the evidence that you provide. So implementation is really how did you do it? And if you look at the assessment grid, also quite comprehensive in what the requirements are. And here, what we would like to see is you need to describe to us. So what was done, where was it done, when was it done, and how was it done. So once you have all of those descriptive questions, and we see that you've addressed them, and also reference them to the particular pieces of evidence that you are going to provide, and additionally to link it to the behavioral statements. So those three major components is what we look for: the how, the what, the when, the where, linking to the evidence and linking to the behavioral statements. So that's core when it comes to implementation. So this submission says, I confirm that dispensing Schedule 4 prescriptions under the direct supervision of a pharmacist falls within my scope of practice after consulting the GPP guidelines. Chapter 3, Section 3.9, Evidence A, and linking to A and B. In line with the Pharmacy Act 53 of 1974, Chapter 2, Section 13, Registration and GPP, Chapter 3, Section 3.5, Personal Indemnity, Evidence B, um, linking to Behavioral Statement A, and Evidence C, linking to Behavioral Statement D. I verified that I'm registered and hold valid personal indemnity insurance, allowing me to legally dispense Schedule 4 prescriptions. After reviewing the Medicines and Related Substances Act Act 101 of 1965, Section 22A in brackets 5, Evidence D, linking to A and B, I gained a clear understanding of the legal requirements for dispensing Schedule 4 substances. I applied this knowledge to develop a prescription validity checklist, Evidence G, which links to A, B, and C, and used it to assess a prescription received on the 8th of July 2025, which I deemed valid. Finally, I consulted the Code of Conduct for Pharmacists to ensure I conducted myself ethically during the dispensing process. So again, ask yourself, did this intern or the student cover the various things we look for of what, when, where, how, and did they make reference to the various evidence and the behavioral statements? Now, when we are assessing as assessors and moderators, we have a look at both the evidence and your implementation to guide us as to how you're showing us your competency. And remember, the evidence is demonstrates to us what you actually did. Next slide. So this is your evidence. And you'll see in terms of the implementation process, as I said, it's linked to the evidence. Now, Leanda, are you able to make it a little bit bigger? Struggling to see. Please, if you can.
Penny, I
And
think Glenn is sharing now, so I'm not sure if we
yeah,
can
no, don't
look
worry.
bigger.
I think what I'm going to do is I'm going to open up my slide on my side and then I'll have a look and I'll just talk over mine. Thank you. So if we look at evidence in terms of the implementation, so you'll see evidence A says good pharmacy practice in South Africa, chapter 3, section 3.9, the scope of practice of a pharmacy student in dispensing Schedule 4 medicines. So, I said to you already, in terms of the scope of practice, it was the incorrect one. It's not the current one. So that piece of evidence is already incorrect. So we would disregard that one. Evidence B, registration as a pharmacy student in terms of the Pharmacy Act. And you can see the information there where they highlighted the Chapter 2 within the Pharmacy Act under registration and highlighted that block, which said the Pharmacy Act now, number 53 of 1974, states that I must be registered as a pharmacy student to be able to perform services pertaining to the scope of practice of a pharmacist, such as dispensing Schedule 4 medicine. And then at the bottom there, you'll see the annual declaration that is confirmed by using information off the web page to confirm that they are actually registered as a student. And then evidence B continued on the last block there, where this individual has provided a screenshot of what the web page or the app reflects in terms of being registered as active. And you can see the details there. Okay, next slide, Brianda. So evidence B continues, and then you can see information around this particular person in terms of their university. You can see which university they're registered with, and then indemnity insurance as well in terms of information provided there. One of the things that we find with indemnity insurance is a common area that interns tend to submit their indemnity insurance as a student. So be careful. Remember, your evidence must be current. It must be in that year of practice. So you need to provide us indemnity insurance that reflects that you are an intern in this current year. Okay, evidence D, where it is Medicines and Related Substance Act 101 of 1965. And you can see the intern there has shown, in terms of the information provided, according to the Medicines Act, it states that I may sell Schedule 4 medicine upon a prescription under the direct supervision of a pharmacist and linking it to Statement A and B. And then the next piece of evidence, you'll see evidence E, which also reflects the Medicines Act. And here the student has detailed how do you identify, or what information do you have to look for in order to identify whether a prescription is valid and authentic. So you'll see linking this to behavioral statement C, and you'll see at the bottom there completed prescription validity checklist according to the legislation, which is provided in evidence F later on. It's evidence G actually. So, and linking this to state behavioral statement A and B, and then the actual evidence of a prescription. So again, highlighting and annotating all of the information around the date and linking it to what was just found in the Medicines Act. So linking it to, for example, the signature, the practice, the MP number, looking at the date, looking at the products. So all of that information, patient details, etc. And then the last piece of evidence there, evidence G on the slide, you'll see this intern had then gone ahead and provided or undertook the formulated a checklist, a prescription validity checklist, which guided him or her around what do they look for. So this demonstrates that, the initiative to be able to be consistent in checking all of the prescriptions that they are going to have a look at in the in subsequent prescriptions. And then the next piece of evidence is evidence H, code of conduct. And here, honor of and dignity of the profession. By adhering to these principles, I ensure that my code of conduct, both within and outside of my professional practice, met the required standards by dispensing only under the supervision of a pharmacist, and linking that to behavioral statement E. And then confidentiality as well was provided by completing the CPD activity. No, the CPD is the next one, which is continuing professional development. Enhancing my professional knowledge, I gained valuable insights into current legislation, ensuring I remain up to date and competent as a trial, oh, sorry, I can't see that, the final year pharmacy, sorry, student preparing for practice. The experience supports my ongoing development and reinforces my commitment to lifelong learning as a future pharmacist. So the code of conduct provides insight as to the information there, and again, the annual declaration. And then the last piece of evidence is the submission of the actual CPD. So those are the pieces of evidence that was provided by this particular intern. And before we go on to onto the moderator and assessor comments, I just want you to take a second just to reflect on what information has been provided. So do you think, and ask yourself, do you think this particular individual linked to the behavioral statements and providing 75%? And was there sufficient to cover at least 75% of the evidence? And then if you look at the grid again, as I said, always go back to the grid and ask yourself, has the description been descriptive in terms of depth? So has there been the what, has there been the how and the why? Um, and then obviously linking each of the pieces of evidence to those behavioral statements. So just take a second to reflect. And if you were the assessor and moderator, what would you do? And how would you grade this particular intern or student? Rihanna, let's go to the next slide. So these were the comments that were provided for the student in terms of implementation. So it is linked to both behavioral statements, at least 75%, and evidence. However, the description of the dispensing activity itself is vague. Only what was described, no how and why. Example, no discussion as to how behavioral statement B, that is practicing within or scope or under supervision, is discussed. So when you're trying to demonstrate under supervision, you want to be able to see on that prescription, for example, that there's a counter signature from the supervising pharmacist, and the intern or the student understands I cannot dispense this prescription on my own. I need to be supervised and guided. um, just telling us this is the scope, but not explaining to us how you've applied that scope for a particular prescription becomes difficult to deem you competent. Yes, we understand you know where to what the scope means, and we understand in terms of where you could find it, but we don't see how you're demonstrating that. So it's the application of what you're trying to show in your evidence is not clear. And that's also a very common problem we see with our interns, where demonstrating how you actually achieved what evidence you're trying to submit, and how you executed that in terms of understanding or showing us that you are competent. So that's a huge gap when it comes to this particular section under implementation and evidence. Intend to show how they applied the acts by linking behavioral statement with the relevant act. So which act is linked to which behavioral statement? And if we look at 5.3, 5.3 looks at the Pharmacy Act, it looks at the Medicines and Related Substance Act, and then it says other applicable legislation as well. So how is it all linked together? Because, within pharmacy, we have multiple pieces of legislation that applies, that we can pull from different areas. We can look at the good pharmacy practice. We can look at education standards. We can look at what else? Your ethical rules and your code of conduct. So we expect you to see your application of all of the things that you learned in your undergraduate year and applying it within this environment. And then keeping abreast of legislation as well. That was missing. There was mention of professional indemnity, and then adhering to the obligations of the code of conduct. So the intern was quite clear in showing us which pieces of evidence linking to the code of conduct, but not telling us really clearly how how was that achieved? Yes, you are conducting yourself in a manner that will not bring disrepute to the profession, but how did you do that? Be clear on what steps did you take to show us that you consider this to be above board, and a good professional behavior. In terms of the evidence, your learning needs related to the dispensing of a Schedule 4 item. So did always link it back to your learning need. Are you answering the question in terms of what you initiated this entire CPD cycle? Under reflection, when you said this is what you want to learn, are you showing us that this is what you're actually learning during the practice and providing the evidence for that? Dispensing relates to the three phases. You have not only demonstrated how you completed phase one, authenticity and legality of the prescription. And remember, the phases then relates to your scope of practice as well. What are you allowed to do when it comes to the phases of dispensing? If you look at each of the phases, which part of the phase is done by a pharmacist? Which phases are you allowed to be doing as an intern, or as a student? So be clear. Then it comes across to us as the assessor and the moderator that you understand how you're applying those dispensing phases, and you understand that you should not be evaluating a prescription completely, where you have to do it under the supervision of a pharmacist. You're doing it under guidance because you need their input as you are an intern, to guide you and show us how this was explained to you. For example, looking at a prescription and whatever it may be it an antiretroviral and understanding the dosage of it or the adverse drug reactions of it or the drug interactions of those drugs and the discussion you had with the pharmacist during that direct supervision. So that's the depth that we would like to see, and it proves to us that you're understanding how you're applying that piece of legislation. There's no clinical review, as I said, and then no evidence for phase two and no evidence for phase three. Next slide. Outdated scope, I've spoken to you about that extensively. So make sure that you are current in when you're supplying any piece of evidence. And as I said, the Pharmacy Council website is a great resource. All the information is current and you can use that. And then ask your pharmacist in charge, your tutor, ask them, what is the current legislation? Am I using the correct legislation? And that's where your tutor is there to guide you, to help you through that process. No evidence that the activity was conducted under the supervision, as I mentioned earlier. Behavioral statement C not met. So a recent amendment within 1 to 2 years was not applied. An amendment from 2017 is not considered recent. And that refers to the scope of practice. So I've mentioned that already. Behavioral statement D, certificate valid at the time of activity. The role of a student is noted as acceptable for this entry as this was submitted by a student. So just to emphasize that this particular entry was submitted by a student. But in terms of your submission as an intern, you need to provide us the certificate that states that you are intern in this current year. And then code of conduct, principle of confidentiality was accepted. And you think if you look at the other pieces of submissions, it was not bringing the profession into disrepute, and then the CPD as well. So there was no clear relevance in terms of how it related to this particular competency standard. How did it all tie in together? Did it make sense? Is it telling the story, linking it to the particular behavioral statements? Or was it just randomly put there just to say I'm understanding the code of conduct, for example? So again, any piece of evidence that you submit must tell the story or the theme of what you're trying to achieve within this particular competency standard, and of course, importantly, linking it to the behavioral statement. So remember, in your intern tutor workshop, when the pieces of evidence, it must be valid, it must be sufficient, and validity is really important. It must relate to that competency standard. Next slide. Okay, so the last step is our evaluation. And evaluation is challenging. And the reason is because often interns uh, don't align to what the grid requests in terms of achieving a complete three. And if you look at what the requirements are and the criteria, it says what was learned in terms of the competency standard. So that's the first thing. You want to tell us what did you actually learn? And remember, you go again back to your reflection. So that was your gap in your knowledge. Now you complete the cycle or you complete the circle in the evaluation step by saying to us, this is what I learned. And you link it to what you wanted to learn at the very beginning. And we want to be able to see that how the learning influenced his or her way of practice. So how did it influence your practice? Did it change anything? This is what you did before, and this is what you're doing now. And that shows to us growth, it shows understanding, and it shows application. And that's what we're looking for in evaluation. And then in terms of annotation, sorry, in terms of application by means of practical examples. So show us practical examples. Tell us exactly a scenario that expresses what you've learned by providing examples. And that's sometimes often missing. And then future learning needs. So future learning need in relation to the skills that were learned, examples need to be specific. So what is your future learning need? What do you want to achieve? Based on the skills that you've just learned. So let's read through the evaluation for this particular student. It says, following this learning activity, I gained a deeper understanding of the importance of ethical and legal practices when handling and dispensing Schedule 4 medicines. So again, gained a deeper understanding. That's so it's extremely vague. It doesn't tell us what did you actually learn. How are you proving to us now that you actually gained knowledge over this process, and now you're able to say confidently, this is exactly what I learned. I recognize the necessity of working under the supervision of a pharmacist to minimize the risk of errors. Rereading the code of conduct for pharmacists reminded me of the professional principles I must uphold both within and outside of the pharmacy practice. This learning experience strengthened my commitment to always follow relevant legislation and to practice within my defined scope. While working in the dispensary, I applied the knowledge I had acquired by using my prescription validity checklist to ensure that all Schedule 3 to 5 prescriptions were legal and valid. When I encountered non compliant prescriptions, I confidently contacted the prescribers to have them corrected. Looking ahead, my next learning objective is to familiarize myself with the handling and safe management of cytotoxic drugs. Next slide. So, what were the comments? No specific examples of applied learning I provided. Provide examples of where the knowledge and skills acquired have been applied to a different activity. So, you have to be very clear in terms of expressing how did this particular learning teach you something within that environment, but a different activity. So, you have to really apply yourself around what examples can you use. The evaluation lacks depth. Why was it important to handle and dispense medicine in a legal manner? So we want to be able to see so you're understanding. Why is it important? Why do you have to interrogate a prescription to be able to make sure that it's legal? And that goes back to your legislation. You know, you have to be able to say that a prescription is valid. You have to make sure to see that a prescription is authentic. How do we know that particular prescription was not written by a patient? How do we know that the MP number was on that prescription? That's what you learned that you must look for. And that makes it a valid prescription. So those kind of details we want to be able to see. And it expresses to us as the assessor and the moderator that you've learned something. How this learning has changed your practice is vague. This learning experience strengthened my commitment to always follow relevant legislation and practice within my defined scope, is the example that was cited. Future learning is related to the handling of cytotoxic drugs, which does not align with Domain 5. Future learning needs should align with a competency standard within that particular domain. So if you look at that domain and you look at what is the overall theme there, and if you look at the other competency standards, your future learning need must align to what happens within that competency. And cytotoxic handling is not directly linked to the competency standard theme of domain 5. So that's what we look for in terms of evaluation. Next slide. Not sure if there's another one. Okay. So you need to address the following in your evaluation. Why was it important for you to complete this entry? And again, link it to what your learning need and what your learning trigger was. What skill did you develop and how was it applied in practice again? Provide a specific example of how you did this. How has this changed your practice? Do you still need to learn? Provide an example of a future learning need. It should not be the same skill. So you can't tell us that I want to now dispense a Schedule 6 script because you've learned how to identify what the authenticity and validity of a script is. Look at that entire domain and see what the theme is and express your learning need based on that particular theme. Okay, next slide. Your evaluation should relate to this domain, so ethical and legal practice. The skills relate to being ethical and following regulations. Applying the regulations and the code of conduct would be appropriate, and this should reflect in your whole evaluation. Your applied learning and future learning need examples should also relate to this particular domain, but the future learning need should not be another application of law or regulation scenario as you have met this learning need within this particular submission. If your future learning need is another application of law or activity, it means that you have not yet met this particular learning need. So, it's have an understanding when you're looking at a competency standard. What is that overall theme? And you look at legal and ethical practice. That is the core theme within this particular competency standard. So we don't want to see you express that that's what you still need to learn, because it means that you still have not learned it. Next slide. Okay, that's we can stop there and take questions. Do we have any questions thus far?
Okay, thanks. Thanks, Fanny. The comms team will lead us on the issue of questions. Let's hear from them. Thank you.
There currently aren't any questions.
Okay, thank you. Thank you so much. Perhaps, I mean, as we go through each of the case studies, and please ask us questions. We are here to guide you and help you. If you have any uncertainties in what we've just done in that case study, please just be free to ask us. It's really an opportunity to improve any of your future submissions. But I'll hand you over to Rianda. Thank you, everybody. Thanks, Rianda.
Hey, good morning, everyone. I am just see maybe we should take a break, a 5 minute break, if you want, if there are any questions. Otherwise, maybe council the office can advise, should we just continue?
Okay, thank you, Rianda. Yes. Let's take a 5 minutes break and then let's come back at okay, quarter past 10. Thank you.
Okay, perfect.
Thank you.
Um, Welcome back, everyone, after the short break. Okay, so when I was started, and I wanted to say I'm Dr. Yanda Yuba. I'm also a moderator of Portfolio of Evidence activities submitted by interns, and I will be taking you through case study, second case study, which is from domain 4. Domain 4 pertains to organization and management skills, and we're going to look specifically at domain competency 4.6, which is policy development. What is important here is that you need to be able to distinguish between what is a policy and what is an SOP. So a policy does not provide a method or a procedure for carrying out a task. It is more created to achieve specific objectives, to maintain order, to make sure that practices are standardized, that there's consistency in the way things are done, and it provides a basis for accountability and transparency, and also to ensure that there is compliance with laws, regulations, and ethical standards. So it's clear that there is a distinction between a policy and an SOP. The SOP is the specific steps that will be used or taken in completing a task. So let's look at this learning title or the reflection title, Learning How to Accurately Apply Policies at All Times, which are relevant to any current practice. And then if we look at the reflection, remember you need to describe your learning need that you have identified that will improve your knowledge and skills, and also what you hope to achieve after addressing this learning need. So the reflection here is a gentleman came in the pharmacy to deliver a couple of boxes from DSV for the ready-made parcel for pickup CCNDD parcels, and he asked to sign for him since I was the only one free at that moment, and he said he'll help since I was clueless. I needed to learn how to accurately apply and adhere to SOPs and policies of the dispensary, especially on stock management. Since I have realized there is a knowledge gap on me, I hope to be more familiar with the steps to be followed when dealing with guardians or partners who are collecting on someone's behalf and what happens to the uncollected parcels. I hope to familiarize myself with SOPs and policies so I can at all times put the needs and rights of patients first and conduct myself in a professional manner and avoid misconduct. So you can see, if you just look at the title, you know it's going to be policies. You don't know which policy. You don't know what the circumstances are. If you look at the learning need, the reflection, if I, when I started to read this, I thought, okay, this is going to focus on receiving. The SOP will be about receiving. And then they say SOPs and policies on stock management. And then they want to be familiarized or familiar with the steps when someone collect a parcel. So from receiving it, the intern jumped to dispensing, or if a patient or a partner collect the medicine. So you can see there's no clear link between what happened, the trigger, the, the delivery guy came and delivered parcels, and the learning need and what they hope to achieve. Okay, let's look at the comments. So this step was indicated requirement not met. And as I've said, if we look at the learning title, it is very vague and it's very general, and it does not describe a specific activity you intend to learn or undertake. And it should not be a near copy of the competency standard. It must be specific to your case. I always say, and I've said it in the workshops as well, if you read the title, you must know exactly what will happen. It's the same as when you select a book from a shelf. If you read the title, then you will know, if I see recipes, then that is what I'm going to get. I'm not going to get step by step how to build a house. So it must be specific and clear what you intend to learn or undertake. If we look at the learning trigger and the learning need, so the trigger and what the intern intend to learn are not aligned and what they hope to achieve. As I've said, they started with the delivery guy bringing in parcels, and the intern was clueless. And then they go on to what will happen, what is the policies and the procedures to follow when someone pick up the parcel. So there's no linking between the trigger and the learning need. So the trigger concerns receiving CCMED parcels and what to do when someone other than the patient collects, but the stated learning need shifts to applying SOPs and policies on dispensary stock management. So you can see there's three different things that this intern is talking about, and it's not clear which SOP or policy they will be applying. So they need to clarify the specific knowledge gap and identify the specific policy and SOP relevant to the activity so that the title, the learning trigger, the learning need, and the intended outcome form one coherent reflection. So it must all talk to one another. It must not be all over and confusing. Okay, if we look at the planning, I plan to visit the dispensary SOPs, especially stock policies. With the help of my colleagues who are more familiar with them than I am, I will include information on policies A, behavioral statement A, and SOPs, behavioral statement B. I plan to participate in other areas or roles in the dispensary so I can improve my knowledge. I plan to make my own notes so I can learn the managing of stock on my spare time. I did all this in order for me to be able to handle or manage the receiving of stock from the driver or delivered stock. I plan to do some work shadowing of the pharmacist learner basic during their management of stock tasks. I plan to visit the dispensary SOPs on delivery of stock. Can we just quickly go back? So you will see that I plan to visit the dispensary SOPs, especially stock policies. So immediately here we can see that this intern does not differentiate between the SOP and the policy because it's two different documents. SOP and a policy is not the same thing. And then they want to look at stock, and then they want to participate in other areas in the dispensary to improve their knowledge. So it's not specific. And they also don't say the specific SOP. So it's just looking at this quickly, you can already see there's not, if you think about the assessment criteria, future tense linked to the behavioral statements, the resources that will be used and the specifics thereof. In other words, which page number, section number, etc., and the reasoning behind the planning. Okay, let's move on. Next one. Okay, so let's look at the comments that was received. For the planning, this intern received the requirement partially met. And the comment is that they should state the specific resources you will consult with full details and refer to the specific policy and SOP relevant to the activity, rather than just mentioning the behavioral statements in passing. So that's what I've said with the resources that you're going to use need to be specific. So up to now, we still not sure which SOP, what's the title, the name of the SOP that the intern will apply. Then because there's only two behavioral statements, you need to provide evidence for both of them. So you need to link each planning element to A, apply policies, and to B, apply SOPs. And you need to show how it addresses the identified knowledge gap. So you can already see if your learning need was not clear and planned out and set out clearly, then your planning will also not be clear. Because if you don't have a clear learning need, you can't plan for that learning need and that knowledge gap that you have. And then, as I've said, you must distinguish clearly between a policy and an SOP. This intern did not distinguish there. And Write the plan consistently in the future tense and confirm that the chosen resources cover the activity. Um, for example, if it's the dispensary SOP on delivery of stock and stock management policies, um, or does it in fact apply to receiving a CCMDD parcel and to someone collecting on a patient's behalf? So you can see it's two different tasks that the intern is combining here, and it's not clear from the learning need and thus not from the planning. Will it be delivery of stock and stock management, or will it be receiving of CCMDD parcels and the collection thereof? Okay, let's see what the intern wrote in implementation and how they actually implemented this plan. Next slide, please. So I consulted the CCMED SOP for guidance on receiving stock in the system and dispensing it to the patient. I managed to capture a couple of invoices for the stock received. I consulted the stock SOP for capturing stock and ordering stock and managed to perform both tasks on my own. So here the intern did two SOPs, CCMDD and um, capturing of stock, collecting of receiving of stock. I consulted the cold chain management SOP on how to receive, store, and dispense it. So now it's cold chain again. On the 15th of January 2025, I received training from my colleague in the pharmacy on how to capture stock on the system using the streamlined receiving SOP. I reviewed the guidelines and policies of the management and conduct of a pharmacy. So it's a lot of things that this intern did. But does this align with their learning need and their planning? And which policy do you think that they apply here? I don't see any policy or application of a policy. So let's look at, I think the evidence is next, and then we're going to look at. So here's the evidence. So you can see here's the SOP um, for the receiving of the CCMDD parcel. Oh no, this is registration enrollment of patients on the CCMDD program and prescription renewal process. So now that they gave us, the intern included the SOP for registering a patient on the CCMDD program. While they said in the planning and the learning need that they want to know what to do when receiving the parcels and when someone collects the parcels. So you will see there at the top that just link it to both behavioral statements A and B. There's no real annotations. There was a signature of the intern and the tutor. Okay, let's see the next slide is also evidence. This is the continuation of the SOP. And then the annexure A, where they have the health facility CCMDD patient registration and prescription record. So this is what needs to be completed when a patient is registered, and also the rest of the SOP, or page 7 of the SOP. So you can see there's no clear. We don't know what this intern did. If you just look at the evidence that was submitted, that this was all the evidence that the intern provided. Let's look at the comments. So for both the description in the implementation and the evidence, the requirements were not met. And as I've said, the implementation described several unrelated SOPs without aligning them to the behavioral statements or to the evidence, the annotated evidence, and it's inconsistent with the reflection, with the learning need. Because in the reflection, it was about really dispensed CCMDD parcel collected by someone else than the patient, whereas in the implementation, it describes receiving CCMDD stock and capturing invoices. So it's not aligned to one another. And because it was not aligned, and clearly because it's not aligned, there's no coherent outcome. And the evidence is not sufficient that was uploaded. and it is also not clearly annotated. There was only one, two small scribbles that it refers to behavioral statement A and B. I think there's some more comments. We can just continue. Okay. So for A, behavioral statement A says apply policies. There's no policies or no policy from the institution where the intern is working. Um, and there's no evidence that the policy was applied. Um, and it's important, a lot of intern stages, they include a section of the national drug policy, and they say by applying the SOP, they link it to that they have applied the policy, but we need to see how you have applied the policy. And for behavioral statement B, apply the SOPs, you need to include the complete SOP. Here was only a few, 4 pages, and it's a 12-page SOP. So you need to include the complete SOP, and then you need what you describe must correspond to the SOP and to the steps. And then you need to show us how you have applied each step in that SOP. So rather select one clear activity, refer to a specific policy and a specific SOP that govern it, annotate your evidence, and demonstrate actual application of both the policy and the SOP. So this intern was advised uh, to submit a new entry and not to fix this one. This was not a fixable activity. So it is important, and you will see sometimes I will make a comment to say that you need to address all the steps in the SOP and provide uh, additional supporting evidence to show how you have applied, and you must cross-link that. So if you say you need to check if the seal on the truck is step A, then I want to see where you have checked that and link it to one another. So then we know you can really apply an SOP and a policy. Okay, let's move to the evaluation. I learned how to accurately apply workplace policies relevant to the task or current practice. I've subsequently managed cold chain medications from receiving them to packing them in the fridge. I've subsequently managed to capture stock on the real-time system after ordering stock the previous week. I've also subsequently learned about the CCMDD program via SOPs on how to receive a parcel into the system, how to issue the parcel or mark it as collected, as the system indicates, for the patient, guardian, or partner in some cases, and what to ask from a patient. I am more aware of handling stock policies and SOPs. I've subsequently managed to control the fridge temperature monitoring. I would like to improve my knowledge in managerial areas, for example, HR policies, and I'm more confident to volunteer to participate in dealing with deliveries than before. So if we just look at this evaluation, remember we wanted to know, what did you learn? So the intern said that they learned to accurately apply workplace policies. They've managed cold chain medications. If you said you learned something here, then I must say, okay, yes, I saw that in your evidence and in your implementation. I can't say that I've seen that you've learned this in your implementation. So what have I learned? What was the impact on my practice? There's no impact. The intern did not indicate what influence did this activity have on their way of practice. Then specific examples. So here they indicate capture stock, cold chain, but it falls all under what they've learned. So there's no real clear specific example of how they've applied what they learned. And then a future learning need. So they did identify that they want to improve their knowledge in managerial areas. And this can be linked to domain 4 of this, where this competency standard fall in. Um, so let's look at the um, comments. So again, the evaluation step was assessed as that it does not meet the requirement. So the evaluation describes general principles rather than the specific knowledge or skills acquired. And because there was no, so you see how everything must follow a line. The story must be the same from the beginning until the end. And then, because there was no policy or SOP applied in the evidence, the intended outcome has not been met. Um, and then another comment was once a coherent activity with a specific policy and SOP has been completed and evidenced, and you state specifically that you learned what you learned about applying policies and SOPs and how it has influenced your practice with an example and a future learning need aligned to the domain and the skills acquired, then only can your evaluation really be assessed. So often, an assessor will say, we cannot evaluate if you have really learned the skill, mastered the skill, met the outcome. And then we cannot evaluate, was your application successful? If you cannot execute the task, if you cannot show us how you've implemented an SOP, and we're not sure that you can do that, then how can your evaluation is then also questioned. But I hope that you can see that there must be a clear line, a golden line that goes from the learning title, and the reflection must go through until your evaluation, where you bring everything together and you can say, this is now what I've learned. This is how I've implemented it. This is how I've used my skill. Um, and this is what I want to learn next. And this is how it influenced the way that I practice. Um, okay, I think, I don't know if there's another, yes. So the next one will be domains 3 that we're going to look at. And my colleague will take you through 3.5. I think we can just go to the questions now. I see there's a few. Okay.
Thank you, Rianda. Now we're going to take questions if they are there. Thank you.
One question, how can we provide that much information and details when the word count on the site limits us so much?
I will try to think this one. Every year it's the same comment is that there's not enough space. But yet we have seen interns that provided all the information and the details. You don't need to write out behavioral statement, the words. You can use abbreviations. You can use BS. You don't need to type out the Medicines and Related Substances Act 101 of 1965. You can use abbreviations for that. And then if you abbreviate, then you can get a lot of information and details can fit into that block. The thing is, and I think we a lot of interns struggle is you have to express yourself clearly but very short. And I know we as humans tend to be elaborate and to write a lot and to explain, but you need to be precise. So if your trigger is precise, then your learning need will be precise, and not fluffy, and then it will fit in. So yes, it can fit in, and you can give sufficient information. I hope I covered the question. Thank you.
Rihanna, can I come in as well? Sorry. Just also to add to that, the annotation also gives us a good idea of application of what you're trying to achieve. So try and be detailed in your annotation because there you have unlimited space. You can submit and annotate and provide detail. And then it becomes really concise in your description. But your description now becomes concise, but the depth and the detailed of long words and long sentences can go into the annotation. I hope that helps. Thanks.
And the last question for now, what does achievement date mean? Is it the day we actually implemented or when we ended planning?
So the achievement date is the date when you were done with this activity. Usually interns will select the same achievement date as the date that they have uploaded their activity. So if you're going to upload today, then a lot of them will put today's date as the achievement date. It becomes a problem when you submit it and you have to resubmit, and now you redo the activity. Say, for example, you did um, counseling of a patient and you were not successful and you have to redo it. So now you start over, you get a new patient that you counsel, a different um, topic that you counsel on, and you leave your achievement date as, say, for example, you submitted in the 30th of March, and that was your achievement date. And then in your new submission or in your resubmission, you say on the 1st of May, I received a patient and I counseled the patient, and then your achievement date still say 30th March, then the activity cannot happen after the achievement date. That is what the achievement date means. So your achievement date is when you have actually completed the task and submit your activity online. Thank you.
Okay, thank you. That's all for now.
Okay.
Good morning.
Thank you, Noctula. Before we go to the next case study, I just want us to address a few questions. Remember, we have shared a link with interns to submit their queries prior to the workshop. So there are three questions that I want us to address now, since they are not specific to any domain. And the first question is saying, is there a way we could increase the number of characters required for the portfolio of evidence, because it really limits us? I think this one has been responded to. The second one, it says, how can I ensure that my title is unique and not a copy of competency standard title? So maybe if we can respond to this one just to guide the intent. Thank you.
Thank you, Tabang. Maybe I'll start with that one. Um, as soon as you include your own activity in the title, something that you specifically compounded or a specific SOP that you applied, then it moves away from copying the competency standard or copying the title. So it's good to customize your title and align it with what you are doing. Then it's usually easy to make it your own unique learning title if you base it on the activity that you are going to do or to submit.
Okay. Thank you, Adele. And the next question is also saying, as an academic intern registered with SAPC, I am required to complete 6 CPD activities or only 3 during the internship period. Kindly clarify the CPD requirements are applicable to academic interns. So I will respond to this one. All interns, irrespective of the category of pharmacy in which they are placed for their internship, are required to submit 6 portfolio of evidence entries and be successful in all 6 in order for them to meet the requirement of portfolio of evidence. So it doesn't matter where you are, whether you are an academic intern or you are at manufacturing, the requirement is the same for all the interns. So you need to submit 6 and be successful in all 6. I'm not sure, Rianda, if you want to add, or Veni or Adele. Thank you.
Thank you, Tabang. I think you have covered it.
Same, Tabang. Thanks.
Okay, thank you. So now the time is 10:45. According to our plan, we were supposed, oh, I'm sorry, Noctula, over to you.
There's just one question that just came in from YouTube. It says, can we please be shown a correctly done activity so we can see how to complete the activity correctly? Thank you.
Tabang, if I can come in with that one, I think 3.5 that I'm going to do now is more aligned with what we are expecting, with a few suggestions and a few things what we would make it better. So I do think as we continue, the intern will get a clear idea, and keeping in mind what was said, what should be added, and thinking about the comments, what should be. But I think after 3.5, the intern might agree that this is a bit more aligned of what we are looking for, but they can maybe comment again if it's not.
Okay, thank you, Adele. So let's wait until we get to 3.5. I was saying initially, I said we will be breaking at 10:30 to 10:45. So let's have our break now and then come back at 11 o'clock so that we can continue with the domain 3 case study. Thank you. Okay, thank you, colleagues, and welcome back. The time is 11 o'clock, so we are moving on. But before we start with our case study 3, there are two questions that came in which I want us to address before we move on to the next presentation. So the first question says, for the future learning need, I was under the impression that it should be related to the domain, but it should be on something new that I hope to learn. However, I was told that it should not be related at all. So does that mean it should just be random? So that is a question about the learning need. I'm not sure who is ready to respond to this one.
Tabang, maybe I'll start with that. Um, I'm going to answer the intern, but maybe they can later clarify. If you have a future learning need, we see a lot of the time an intern compounded a product, and then they say their future learning need, say, for example, they compounded a cream, they want to compound an ointment. So, in that way, it should not be um, related because it's in the same competency standard and it's exactly the same skill in this case that you now learned. But within the domain, it should be in domain 5. All of the competency standards in domain 5, it should be related to them, but it should not be related to the activity or the same as the activity you just did. Interns also do that for the public health campaign. They did a public health campaign for hypertension, and their future learning need is to learn to do a public health campaign for asthma. That's not correct because you are now able to do a public health campaign. It should be a new skill that you want to learn within domain 1. I hope that answers the intern.
Okay, thank you, Adele. Um, and then the second question is from Domain 4 Policy Development. It says, so let's say your CPD is on receiving cold chain items, and as part of your evidence is a pharmacy SOP on receiving stock. However, your focus is on receiving thermolabile items, which is also part of the SOP. Do I still need to include the whole SOP that like 12 pages when maybe the cold chain part is just 2 pages?
Tabang, maybe I'll start again with that one. The intern can maybe include the front page and then an annotation. This SOP includes the following, but I'm only focusing on cold chain and those two, but not just the cold chain section. But tell us, the SOP is 12 pages. It includes all of this, but I'm focusing on a specific part. Some pharmacies have the cold chain separately. In others, it's included in one. But just annotate properly. Give us the front page to see that the SOP is in date or up to date. And then the part that you actually use and a proper annotation to explain why you've included that section.
Okay, thank you. So now we can proceed with the next case study. I think so far we have responded to all the questions that were submitted. Over to you, Adele.
Thank you, Tabang, and good morning, everyone. I'm going to take you through Domain 3, Competency Standard 3.5, and hopefully now you're at the stage to look at the title and know if it adheres to the requirements and to start understanding what we require. One thing I do want to tell the interns is we sometimes see that interns select 3.5 because there's only one behavioral statement, and that's applying pharmaceutical knowledge to the formulation and compounding of medicine. And they select that because there's only one, they think it's easy and there's not a lot of evidence, which is not the case. So they should be careful of thinking about the number of behavioral statements and align that with the evidence that should be included. Another mistake interns make is to reconstitute the antibiotic. That's not compounding, or they take 2 bottles of cough mixture that the doctor prescribed, and they just add those 2 bottles into a new bottle that is also not compounding, and we have seen that. So if we start with this activity, so we can have a look at the title first of all. And if you look at the title of this competency standard, you can see the application of pharmaceutical knowledge in the compounding of oral vancomycin syrup using vials of vancomycin powder. And the intern previously asked how to use a unique title, and by reading this title, you can clearly see what this intern is planning to do. So the reflection: on the 2nd of May, I observed our pharmacist compounding a magic mouthwash. I watched her as she applied the different compounding techniques based on the knowledge she had of the API and the excipients. This experience triggered my learning need to improve my competence in applying the information we learned in pharmaceutics lectures and from research on APIs, excipients, and compounding techniques to make a stable, safe, and patient-friendly dosage form. I hope to be able to apply the information on the physical and chemical properties of the APIs and excipients that I find in pharmacopoeias and other resources to ensure the compatibility of the excipients are used in the compounding process for stable dosage forms to be made. I also hope to learn effective compounding techniques and to sharpen my calculation skills when working with different master formulas. I also want to be able to apply the knowledge on the stability of APIs to determine the storage conditions of the compounded products. So if you look at that and you think about the grid, we all agree that it's clear on the title. And by reading the reflection, you can see what the intern wants to learn, what they want to achieve by doing this competency standard. Oh, so if we go to the comments, so you can see the title is met. The learning needs are met, but as we said, the assessor may make a recommendation to you. So you can see the learning need there's an authentic trigger, observing the pharmacist prompted the need and what they want to achieve. And there is a suggestion to fully strengthen it further. Frame the trigger explicitly as a situation in which you needed to apply 3.5 yourself rather than only observing somebody. But you can see there is a suggestion that it triggered something that happened to you and not just the observation that made you realize. But you can see that this learning need is clear. The assessor and moderator knows exactly what this intern wants to achieve, and the learning needs are met. So when we go to the planning for this intern, I will read the XXX guidelines. So we just removed that because for confidentiality reasons, for compounding and section 2.1.8 of the GPP, which focuses on compounding. The guidelines will provide useful information on the procedures followed when compounding, and section 2.1.8 of the GPP on page 131 will help me compound medicine following regulatory requirements, which ensure quality assurance and patient safety. Using this information, I plan on making a checklist that I will use when compounding to ensure that I follow the correct procedure. I plan on also reading journal articles and pharmacy practice textbooks on different compounding techniques. Before I compound, I will look for information on physical and chemical properties of the APIs and the excipients on PubChem website to apply during the compounding process. I also plan on applying the compounding techniques I've learned in pharmaceutics and asking the pharmacist about my technique. They will find to be effective when compounding a specific dosage form. So when we read this, I can see what the intern is doing. If I go to the grid, remember we want specific details of the resources. So which pharmacy textbooks are we referring here to? Reading journal articles, maybe which journal articles, but you can see the planning is almost there. We know what this intern is going to do. We know the hospital guidelines. We know the GPP. So it is more or less clear what this intern plans to do. So if we go to the comments that this intern received on that, you can see it's partially met. It is in future tense. There is a rationale for the resources. and it links to the behavioral statements because there is only one. The details of some resources are incomplete. As I stated, we talk about pharmacy textbooks and journal articles, but we don't know which one it is. PubChem, we don't know when they're going to access it, which compound they're going to access, specific information of what's going to be done on PubChem. And the plan should also state specifically what you intend to compound. We've seen it in the title, but we haven't seen it in the planning yet. So you can see the intent is almost there, just it's partially met, just that extra information if you go to the grid, just to make the plan fully compliant. But when you read the plan, we were almost sure what the intern was doing, but the finer detail was not mentioned, which should be added. So if we go to the implementation phase, and there the intern stated on the 8th of May, we received a prescription for vancomycin. There we get to what we're doing. For a patient at XXX hospital, I validated and interpreted the prescription and asked the pharmacist since I was unfamiliar with the procedure. I then compounded the vancomycin syrup based on the formula provided in the pharmacy records. Before compounding, I looked at vancomycin's stability to ensure that it would truly dissolve in water. That's the pharmaceutical knowledge. I also refreshed my knowledge on the reconstitution of powders in a vial. I washed my hands and cleaned the work area and compounding equipment. I reconstituted the vancomycin vials using sterile water, applying the 45 to 90-degree technique of puncturing the vial's rubber bung. I then drew the solution from the vial using the milking technique, then mixed it within the syrup simplex and sterile water to make a syrup. I also used vancomycin stability information to determine the storage conditions, and I labeled the bottle and completed the compounding record. So you can, just by reading this, you can almost see the steps that the intern followed to complete this activity. So now remember the implementation, the evidence follows one another. And there you can see the intern provided the compounding procedure steps, and they linked it there to the GPP. But these steps, so it's good and it should be there, but we wanted to see how they use the steps in the evidence. So what we would expect is to link this procedure to the photographs as well, but we will get to that. You can see there's a compounding SOP with some annotations and some steps. We just protected the confidentiality of the provider for this. So you can see there are some additional annotations where the intern provides some clarity on the SOP. So we can go to the next page of the evidence. There you can see the GPP is also there with some highlights and some annotations within the steps of the GPP, where the intern clearly shows us what she's going to use and what she annotated and why it's there. You can clearly see she annotated the batch traceability and the clean equipment and the washing of the hands and the basin. And we have the prescription there that the intern annotated. But what they didn't include is how they evaluated the prescription for ethical and legal compliance. So you can see that is there. We can continue with the evidence on this one. So there's a master batch formula for the syrup that the intern is going to make, the recipe and some annotations and the calculation for that. And she included the PubChem information that she used to look for the stability, um, which you also mentioned in the application. So you can see there's one behavioral statement, but it's not just one piece of evidence. Then the intern provided a photograph where she's washing her hands, but what would have been good is to link this to where the GPP says there should be a basin and where the procedure says you should have the following available. You can see she has her equipment. It is annotated, but it's not linked to the base documents or the regulatory document, the SOP or the GPP. So the intern followed all the steps, but she could have included a little bit more annotation and cross-linking between the SOP, between the GPP and the photographs. Say, for example, the GPP says, I should wash my hands, or there should be a basin. here it is, it's in this photograph. And you can do all of that in your annotations on your evidence, and then the space is not a problem. So you can see she's washing her hands, she has all her ingredients available. We can continue with the next part of evidence. You can see she is drawing it up. She has a needle. She has the annotations. And again, it would have been good to link these photographs to the various steps of the master formulary or the master recipe, to say that the master recipe says, I must do this. I must draw it up in a syringe at a 90-degree angle. This is the photograph. I am doing this. So the photograph is there, but now the assessor needs to just do the cross link, and she could have just mentioned this is step 4 of the SOP, this is step G of the GPP, if that makes sense. So you can clearly see the photographs are quite clear. Everything is clean, what the intern is doing to create this syrup. You can go on to the next page. So there you can see the intern talks about the 90-degree angle. She's showing a photograph of where she's doing that. She's talking about um, this. She's showing the angle, but then again, where in the master formula does this say it should be done, or is it there, or is just additional? So just give us a little bit more information of where this links to. It should probably be in the master formulary. So just that final link to show us how you applied the master formulary and how you adhere to the steps within the GPP. So you can see the intern provided the evidence there. She continued on with some more evidence. You can see she's adding it to the withdrawing it from the vial. She made some annotations of what she did. It's very clear. It's quite a good submission. The intern could just have gone a step further to to go from partially met or to fully met by doing that additional annotation and linking it clearly. Her photographs take the legislation or the guideline or the SOP and show us how you did it, where you did it, which photograph shows which step. So we can continue with that. There she's using the bin. She's making the final product. She's putting it into a amber bottle. We can just go past the steps. Again, she's adding the liquid, she's labeling it, she's putting it for cold chain, for storage. She has some stability information there, and that shows the temperature where it should be kept at. And we would expect to see that in the master formula as well. And there we should have wanted to see a cross link to that as well. But you can see it's very clear what this intern did. She attached the final label. She protected patient confidentiality. And please, we just cover the intern's face for this presentation. You should not cover your face. You should annotate yourself. There's her batch manufacturing document. She's provided a new a batch number for batch traceability. She's provided the expiry date there. Um, you can see her expiry date there is a bit small, but it is within the guidelines. We would expect you to address the expiry date. There's a lot of things covered there. Um, but you can see this is everything we need to see, and you need to annotate that and link that. For batch traceability, you will again link to the GPP where it says a system for batch traceability should be there, and that is why the intern assigned a new batch number. All the ingredients, their batch numbers, everything. So the implementation and the evidence, you can see it's partially met. There are a few cross links that we wanted to see. Evidence is well documented, specific to the competency standard, and demonstrates sound background research on stability, compatibility, solubility, palatability, shelf life, storage, the correct technique for withdrawal, accurate measurement, and a complete master batch document. If you wanted to have fully met, as I stated, you should show how the information from the resource, example, the master formula and the GPP, informed your steps, and link this to the annotated evidence. So all the evidence is there, and this intern would have been successful, but you should just go that step further and link everything. So link the photographs to the regulatory documents as we said, the master document, the GPP, and all that information do have a fully met in this section. So you can clearly see what the intern did. It's just that final cross link and cross annotation that was missing here. So the implementation, you can see cite the legislation you used. She did interpret the prescription, but she didn't tell us which legislation she used to do that. Explain how you determined the quantity. Um, it should have maybe been just the annotation on that master formula in her, how she used the formula provided in the master document in her own syrup that she provided. Address the personal protective equipment. She does put on a cover her hair. She just should have explained that better. Endorse the expiry date as used within 14 days, and that she had in her stability data. So she just had to cross-link there, and stability in a plastic container. She put the new mixture in an amber plastic container, but she did talk about stability, and then she should have just that final container. She should have addressed the stability according to the resource that she had, or linked that to the master batch document where it states it should be in an amber container. So it's very careful for you to cross-link and annotate all the evidence so that all the pieces of evidence speak to one another. Everything is linked. The GPP and the master document is linked to the photographs or linked to the stability information that you found on PubChem, and just structure it that everything is linked to a specific step in either the GPP or the master document or the SOP or what the case may be. But you can see this is a good submission. The intern just had to do some finer changes. For the evaluation, I've gained a deeper understanding of the importance of applying pharmaceutical knowledge of APIs, excipients, and compounding techniques when compounding medicine in order to make stable dosage form and to determine their storage conditions. I've learned the different compounding techniques used in compounding, especially when adapting parenteral formulations to oral use. I've also learned how to use credible online sources to get information on APIs and excipients. I now feel more confident when compounding. I now ensure now ensure to research on every API, excipient, and procedure to ensure I compound a stable, safe, and patient-friendly dosage form. I was able to apply this knowledge in compounding a mixture of potassium chloride. You can see a specific example where syrup simplex was also added to improve palatability of the dosage form. I have, however, identified a future learning need in the different compounding techniques used in other dosage forms, such as ointments and suppositories. So if you look at that, we can see what knowledge she gained and how it changed her practice. There's a clear example. And you can see in this case, the future learning need is still within compounding, but this assessor of this, it was accepted because it's completely a different, it's not a cream and a cream or a cream and an ointment. She now did a sterile, um, a compounding of one dosage form to another, and this future learning need was accepted. A clear example applying, so she's going to do potassium chloride instead of simplex, and an appropriate future learning need. So this is another skill that the intern wants to learn. So just ask yourself when you identify a future learning need that it's new knowledge and new skill within the same domain. So if we go on to the next one, I do think that's the end of 3.5, and I hope you've seen what the intern included there, and it's quite clear what the intern did. It's just that final linking of the photographs to the regulatory documents or to the source documents, and clearly showing where she applied every step in the evidence. So thank you, Tabang. I don't know if there's any questions on this competency standard.
Okay, thank you, Yanda. Yes, over to you, Noktula.
The only one now is if a CPD did not go through for whatever reasons, are we expected to redo the activity or just fix what was commented on? Or will we be told to redo if needed?
So, it's a difficult story, Rianda. It's a difficult question to answer because each case is um, different. If it's just patient confidentiality, that's something that you can just scratch out. It was a mistake you made and you can resubmit. If you held a public health campaign and you didn't have an attendance register, you didn't show the public, you didn't show where and when the campaign was, and you actually do not have that, then you cannot resubmit. You cannot, I don't want to use the word fabricate, but if you have to create evidence to resubmit, then that's your answer that you need to redo. Your assessor will tell you redo or fix this or fix that. But if you need evidence and you made a mistake that you cannot fix, you have to redo. It's not possible to fix a mixture that was made 3 months ago. It's not possible to create a batch manufacturing document that if you did the mixture 2 months ago. So it's usually a redo, but sometimes a fix depending on what the mistake was.
Okay, that's it for now. Thanks.
Okay. Thank you, Noctula. And in the absence of any other question, we will move on to the next domain, that is domain number 1. And this is going to be presented by Prof. Badayachi. Over to you.
Thanks, Tabang. So this particular domain comes, this particular competency comes from domain 1. And domain 1, 1.1 is one of the most popular submissions. So it's quite an interesting one, and the theme around this particular competency standard is around the promotion of health and wellness. So health promotion is the process, sorry, you can go back, Randa. It's the process of enabling people to increase control over and to improve their health. Next slide. So the reflection title here is conducting a public health campaign on vaccines at a particular hospital. So if you look at and interrogate that title, just try to recall all of the information that is shared so far. And what do you think? Do you think it's a fairly good title? If you were an assessor or a moderator, what would you accept it or not, based on what we've been explaining thus far? So the reflection says, during my internship at this hospital, I observed that many patients were unaware of the importance of vaccinations in preventing serious illness. One patient believed vaccines were only for children, highlighting a significant need in public education on immunization for all age groups. Additionally, I noticed frequent prescriptions for preventable diseases, reinforcing the need for proactive health care. Recognizing this gap, I took the initiative to initiate a vaccination awareness campaign within the hospital. I hope that by providing accurate information, addressing misconceptions, and promoting vaccine adherence, this empowers individuals to take charge of their health. I see it as my duty to educate the community on diseases, disease prevention strategies, including the role of vaccines. Through this, I aim to learn to enhance my ability to educate the public, promote disease prevention, and build confidence in providing health-related information. So this is quite a comprehensive and descriptive reflection. So I think take a moment to have a look at whether the learning trigger was there, whether the learning need was there, and whether the future learning need was also reflected within this. Next slide. So learning title, the assessor found this particular and moderator found this particular title to be suitable. So the title was original and descriptive. The learning need was partially met. So the learning trigger is present. So this was the comments. The learning trigger is present, but the learning need is framed too narrowly around vaccine awareness and around what you did rather than what you hope to learn. And that's an important comment because often what we find in 1.1 is the focus is around the actual disease or the actual theme around what is being presented rather than what you are expecting to learn for yourself as an individual. So remember to, yes, you can highlight and inform us on based on the trigger and why you chose that topic, but also what are you hoping to achieve? So if you look at the theme of this, how to present on a particular educational matter, and it's essentially teaching you how to go out and deliver this information to the public. And that's what we want to see. So don't focus too much on the, for example, in this scenario, vaccine awareness, but also remember to focus on what you want to learn. State a general learning need that needs relates to the competency standard and its behavioral statements. And that could be applied across any health promotion activity and clearly identify the knowledge or skills that you need to improve, as I've said already. Note that Domain 1 emphasizes the promotion of community health and provision of information and advice to communities, not to individual patients or small groups. Elaborate on how your learning needs align with behavioral statements A to D. So it's important also to understand what the difference is around what a small group is and maybe two people. Do you consider that to be a group? So that's the other challenge that we find within this particular competency standard. Next slide. So the planning, I will seek approval from my supervisor to conduct a vaccination awareness campaign focused on educating patients about the importance of vaccines, encouraging their use, and addressing misconceptions. To ensure accuracy, I will refer to the standard treatment guidelines and the essential medicines list, chapter 22, pages 451 to 455 for vaccine schedules, the National Immunization Guidelines, section 2023, section 4, pages 32 to 40, for disease prevention recommendations and the CDC and the WHO for vaccine safety, efficacy, and benefits and healthy lifestyle habits. I will design an educational pamphlet covering the role of vaccines in preventing infectious diseases, Behavioral Statement 1.1b, Common vaccine preventable diseases, Behavioral Statement 1.1b, vaccine schedules and eligibility by age, Behavioral Statement 1.1a, healthy lifestyle habits to support immunity and overall wellness, Behavioral Statement 1.1c. Additionally, I will create posters for hospital areas to maximize outreach, Behavioral Statement 1.1d, and develop a feedback form to assess patient understanding post intervention, Behavioral Statement 1.1a to d. Okay, so it's quite a comprehensive planning, gives us details on which resources that individual will use in order to identify the information that they are going to deliver. But also you can see there's links to specific details of that resource, additionally to the behavioral statements and how it aligns to each of the reference material that was suggested. So I'd like you to also just reflect here, what do you think is missing in terms of deeming this a full three, fully competent? Next slide. So this one is partially met by the assessor, and the reason being is the plan is in the future tense and lists resources, but it lacks sufficient detail to demonstrate that the public health campaign can be delivered successfully. Add the specifics of the activity, when and where the campaign will take place, who the target audience will be, and why the topic is suitable for them, and how and what will you present, where the posters will be placed, and why those areas are appropriate, to whom the pamphlets will be distributed. Explain how you will verify that you have reached a sufficient number of members of the public. For each resource, give the full reference, title, section, page, date, version, and the reasons for its use. Ensure that your planning is sufficient to achieve at least 75% of the behavioral statements. So this is the assessor comment, and you can see there's a lot of depth that you want, that the expectation is around the what, the where, who the audience is, be specific about who you're going to deliver it to. Again, this is part of your planning section, so we need to understand how are you planning to achieve what the behavioral statements require. Next slide. Implementation. I researched and gathered evidence-based information to ensure my vaccination pamphlet and posters were informative. Evidence 1 to 6, behavioral statement 1.1 A to D. Once satisfied with the accuracy, I designed and compiled the pamphlet, evidence 9, and posters, evidence 7 to 8, incorporating key details on vaccine preventable diseases, schedules, and the importance of immunization, behavioral statement 1.1 A to D. After obtaining my supervisor's approval, I conducted a vaccination awareness campaign at this particular hospital. Evidence 11, behavioral statement 1.1A to D, 1.1A and D. On 14th of February 2025, I presented to patients, explained vaccine importance, addressed concerns, promoted adherence, and distributed pamphlets. Evidence 12, behavioral statement 1.1 A to D. Posters in high traffic areas reinforced key messages. Evidence 10, behavioral statement 1.1 A and D. To evaluate effectiveness, I distributed feedback forms to assess patient understanding. Responses showed many gained new knowledge on vaccine preventable diseases and the importance of adherence. Evidence 13, behavioral statement 1.1 A to D. Next slide. So this was the evidence that was provided. And I'm just going to look at my slide because I can't see a thing here. Okay, so for this particular piece of evidence, evidence 1, you'll see on the left, sorry, on that, it's a picture of the, barely can see it, but I'm going to try. So it says, I read through this article from the WHO, which explains the science behind vaccinations, how they stimulate the immune system, and their role in preventing infectious diseases. The knowledge gained from this article was applied directly during the campaign. It helped me engage with patients, answer their questions, and deliver evidence-based information to encourage vaccination uptake, achieving behavioral statement 1.1D. And that you can see there's a picture of exactly where it came from, and you can see the link to the WHO page right at the top. The next evidence is, sorry. Give me a sec. So here you can see that the intern has provided further information on what your doctor wants you to know about vaccinations for kids. And the information here at the bottom says the infographic was from a FP providing key facts about vaccines for children, including their safety, effectiveness, and role in preventing diseases. It highlights how vaccines protect not just individuals, but entire communities through herd immunity. The infographic also addresses common concerns about side effects and emphasizes the importance of following the vaccine's schedules. I use this to create a poster as part of my campaign materials to educate parents, helping them make informed decisions about vaccinating their children, fulfilling behavioral statement 1.1D. This resource helped me educate the public by providing reliable information about vaccines, reinforcing their importance in disease prevention on achieving behavioral statement 1.1A. The infographic clearly outlines how vaccines reduce infection risks, supporting my role in advising parents about protecting their children from vaccine preventable diseases, completing behavioral statement 1.1B. The next piece of evidence, and I'm not going to go through the readings, but you can see for the purpose of time here what the infographic looked like. and gives a description of what that means. And then the next slide provides further information on strengthening how to strengthen the baby's immunity, and then also talks about vaccines preventing diseases and gives information on that and where that came from. And then the next further to that, talking about the side effects and why should your child be vaccinated. And then the next slide is the immunization schedule, which comes from the standard treatment guidelines. And you can see all of the information there. And then following that is evidence of, again, the standard treatment guidelines. And then you can see information around healthy lifestyles. And if you look at the competency standard and you look at the behavioral statements, you'll see that there's very specific information that is required in terms of 1.1, which it refers to healthy lifestyles, for example. So when a behavioral statement says, this is what I require, make sure that it is part of the evidence that you provide and that it aligns to that. So we want to be able to see that. So often what we find in 1.1 is that there's a whole lot of information that is provided, but the specifics, for example, on healthy lifestyle is not evident in the evidence or even in the pamphlet that you may distribute to your patients, which becomes very difficult for us to assess you because that's a large gap in your evidence. And then subsequent to that, you'll see the pamphlet that was handed out, which is evidence 9, and it gives a clear description of the importance, the preventable diseases, healthy lifestyle tips or immunity, how that was achieved and what information was put in there. And then evidence 10. And then following that, you can see the actual picture of where this was done and how it was done, information, and you can see groups of people as well being um, um, delivered the information to, and then the feedback is the last one. So that was all the pieces of evidence that was provided for this particular submission. So in terms of the comments, so the assessor found the implementation to be partially met. Um, and the reason being, to whom did this presentation go out to? It wasn't very clear. It wasn't clear at all to say, so who was your audience? Because remember, in order for us to ascertain whether the information that you've provided is for this for an audience that is suitable, we need to know whether it was who was the audience that you actually presented to. So that really is important. And often we find there's a disconnect between the two where I can't think of an example right now, but where it's almost like providing information on pregnancy to babies. A really bad example, but that kind of thing. We want to see there's a connection between the information you're delivering to, information that you're delivering on, and the audience that's receiving it. So where did the presentation take place? Where were the posters placed? What did the presentation consist of? What questions or concerns did patients raise? Which resources did you use? And state clearly which legislation relates to public health campaign conducted by an intern. Next slide. So the evidence was not yet met. So the evidence does not yet demonstrate at least 75 of the behavioral statements were performed, that enough members of the public were reached. So if you look at the picture, you have to question in terms of whether this really is deemed as a public health campaign. Do you think that you reached enough, a large enough audience to successfully to say that you can now implement this type of education campaign to wider audiences, when in the picture it was quite clear that there was very few people that it was delivered to. References are aids only and are not accepted as actual evidence. A properly headed attendance register is required. 2 feedback forms and an affidavit are insufficient to show reach. The presentation itself must be submitted. Your own posters and pamphlets should have the presenter's name and date. So information like the pamphlet uses technical terms that should be made accessible would benefit from references on an immunization and an immunization schedule. Some parts are not legible. Provide evidence of poster placement. The poster shown is small, illegible alongside other prominent posters. A single, clear, plain language poster may be more effective. Next slide. Correct the factual points raised. Example, influenza is not fully preventable by vaccination. Confirm current COVID-19 vaccine availability. Additional preventable diseases could be listed, and consider addressing vaccine hesitancy. Per behavioral statement A, explain what vaccines are and contain to support health promotion and counter hesitancy. B, give more detail on disease prevention through vaccination and lifestyle and on the preventable diseases themselves. C, actively guide attendees to healthy lifestyle and other prevention messaging, example, hand hygiene, mask use, not only via a separate poster. D, demonstrate genuine public engagement across cohesive, mutually supporting media, presentation, pamphlets, reaching a verifiable, suitable audience. A new implementation, description, and portfolio entry will need to be submitted as this entry cannot be corrected with the current evidence. Okay, next slide. Evaluation. Participating in this campaign was an enriching experience that reinforced the importance of public health education. By designing an informative pamphlet and engaging with patients, I addressed misconceptions, promoted vaccine adherence, and empowered individuals to make informed health decisions. This experience strengthened my communication skills, enhanced my ability to educate the public, and deepened my understanding of pharmacists' role in health promotion. The campaign was successful as more patients were now coming in for immunization. Inspired by this, I've contributed to discussions on other public health initiatives at this hospital, including TB awareness. Moving forward, I aim to improve my ability to create engaging educational materials and to incorporate interactive elements such as Q&A sessions. By continuously refining my health promotion efforts, I am confident in my ability to enhance vaccination uptake and overall public health awareness. Next slide. So this particular evaluation was met, but you can see that it was quite comprehensive. It was clear what was learned. It was clear what the next new learning need will be. So the comment from the assessor is the impact on your practice and example of applications are clear. To strengthen the entry, make each of the four evaluation points speak to what you learned about the competency standard, promotion of health and wellness, and its behavioral statements, rather than about the campaign topic, and focus on what you learned rather than what you did. Provide specific details of how you have subsequently applied the acquired knowledge, and identify a clearer future learning need that relates to the domain rather than this specific activity. You have partially described what was learned, but the evaluation should make clear that you learned about PIT as a skill. I'm not sure if this is the right one, Rianda. This doesn't look right.
I think that is misplaced,
Yeah, it looks
Vinny.
like it was misplaced. Yeah. So that was essentially 1.1. And as I said earlier, 1.1, it's a very popular one. It's quite simple to do, but the biggest challenges with that one is the audience and also the feedback. Make sure your feedback is comprehensive. So we can see that the information that you delivered to the audience is actually successfully understood by the audience. And then obviously make sure that the information that to whom you're delivering it is actually the audience that should be receiving it. But essentially, remember that this particular domain is to show us how you've grown in terms of competence to ensure that you're able to deliver information on health campaigns going forward, irrespective of where you're doing it, but you are able to do it successfully. Thanks, Tabang.
Okay, thank you, Vinny. So that brings us to the end of a case study on domain number 1. And then we're going to take the questions that have been submitted. Noktula, over to you.
First one is, when writing reflection, do we generalize or be specific to the activity we're going to do? For example, if I'm doing compounding for domain 3, do I say I aim to learn how to compound, or do I say I aim to learn how to compound a certain medication?
Nocturnal, I'll take this one first. Remember you're doing the specific activity to achieve the competency standard. So at the end, what you hope to achieve should look at the bigger picture. You want to learn how to compound. So you hope to learn how to compound this, but the bigger what you hope to achieve is to successfully compound various kinds of um, products in future.
Another one on compounding. Do we need to show that the pharmacist needs to provide quality assurance steps between each steps of a compounding? It was not mentioned in this presentation.
If that is part of your depending on what you're compounding, the pharmacist needs to sign off on the batch manufacturing document, then you have to do it there, yes.
That was our last one for now.
Okay, thank you, Noktula. There are other three questions that were submitted on the link. And the first one says, do we have to pay the late fee if we submit after the 1st of June, but before the 28th of June? We are competent in 3, but haven't received results for the last 3. So I think here the intern wants to know if they have submit or they are competent in 3 entries but not yet submitted. I mean, received results on the other 3. I think they want to know if they will be penalized when they are booking if the results are not yet released. So what is happening is there are deadlines for booking, which are provided in the presentation, the feedback presentation that we have uploaded on the website. If you can go there to familiarize yourself with the dates. But for the coming exam which will take place in August, interns are required to be competent in 3 activities and have submitted 6. So meaning even if the other 3 are not yet assessed, as long as you have submitted, you will be able to book for the exam. So the normal booking will open on the 22nd of June, meaning if you're booking, that is the same day on which we will be releasing results. So if you book any time from the 22nd, you will be able to book without having to pay the late booking fees. But if you are not yet successful in 3 entries by that time, unfortunately, you will have to wait for the release of the result, and the next date will be the 20 July. By that time, the normal booking would have been closed. Therefore, you are going to pay for the late booking penalties since you would have missed the normal booking period. So interns must just go and familiarize themselves with the dates so that they don't miss the normal bookings. And the other thing that is important to mention is that interns must also check the requirements in terms of the portfolio of evidence in order to be able to sit for the exams. So depending on the date of registration, like interns who registered for internship this year, they will be required to be successful in 3 entries, but they should have submitted all 6. And those who registered or they are in their 9th month of internship or more, they are required to have submitted 6 entries and be successful in all of them. So just make sure that you go back to the manual as well as the presentation slides to check that information. And then the second question was, why should the specific resources used, such as website, be named in planning? Isn't the planning stage for what we want to do? We don't necessarily know exactly what web page we want to consult at the time of planning. Shouldn't it be more important to note this in the evidence and implementation? So colleagues, I think you can assist in responding to this question. Thank you.
Siobhan, can you repeat the question, please? Sorry, I missed the first part.
Okay, the question says, do we need to have I'm sorry. The question says, why should the specific resources used, such as website, be named in planning? Isn't the planning stage for what we want to do? We don't necessarily know exactly what web page we want to consult at the time of planning. Shouldn't it be more important to note this in the evidence and implementation?
Thanks to Bang. So the planning section really is it's almost, I always used to use the example of a recipe. In order to bake a cake, you have to have a recipe, and your recipe is the planning section. So to know that you're going to bake a chocolate cake, you need to know, flour, sugar, eggs, whatever it may be. So it's the same with your evidence when you're trying to say you are doing 1.1. In order to know, okay, I'm going to do a campaign on vaccination. So where would you find information on vaccination? That's part of your planning. So that is really one of the steps in order to guide you. What is your next steps in implementation together with your evidence? So you've already established you're going to use the WHO website for information on vaccination, and then your evidence will support that by showing us this is what you used. So the planning section, the resources are critical because then it shows us that you've done some background research to identify how you're going to achieve that particular step. I hope I've answered your question. Thanks, Devang.
Thank you, Veni. And then we're moving on to the next question. It says, do we need to have 6 resubmitted by 1st of June to qualify for the August exam? Or is like a submission in March with a fail valid and doesn't need resubmitting if we pass 3 and have completed 6? Should I resubmit the 6 even if they're not ready and have failed before? Okay, let me respond to this one. I think the intern here wants to know that if they have already submitted 6 entries and they are successful in 3, will they be able to book for the exam, or are they required to make the resubmission prior to the exam? So as long as you have submitted 6 and you are successful in 3, that's enough for you to book for the exam. You will make the resubmission when the entries are ready. So you don't have to rush the resubmission. Just make sure that you take your time and do the correct thing and make your resubmission when you have covered all the assessment comments. Yeah, that's how I understand this question. And let's move on to the last question. It says, it would have been in the best interest of both tutors and interns if this presentation was presented much earlier on in the year. My intern and I worked very hard on her submissions, most of which were rejected as she was missing critical information. This presentation was clear and explanatory, would have saved my intern from experiencing so much stress and disappointment. Um, so yeah, I think this comment is noted. We will take it into consideration when we plan for next year, just to see how best we could assist the interns earlier to avoid all the distress they experienced. And let me allow my colleagues also to comment on this one. Thank you.
Tabang, and thank you for the comment. I assume the tutor referred to the voice over presentation. The problem for not being able to do it earlier is we have not yet seen what the interns submit and where the pitfalls are. So it's difficult to give them feedback if we haven't gone through a few rounds of assessment and moderation. Um, so yes, that would be yes, that's the main reason for it only being now. But perhaps we can incorporate some of those information in the training workshop at the beginning of the year. I don't know if that can work, but yes, that's my 2 cents.
Okay, thank you, Rianda. That was the last question from my side. And now we can move on to the way forward. Or Noctula, yes.
We just have a couple more. What if you've mixed up the domains? Obviously, you changed to a new domain. Now, what do I do with the first incorrect one?
If I understand this question correctly, then the intern have submitted the activity in the wrong domain. So if it is just the domain that is incorrect and they must change it to a new domain, I can't see why they have to do the whole thing over. They can just select the correct domain. Maybe Vinny and Adele can um, add on to this.
Thanks, Rihanna. Yeah, I think you've covered it pretty much. That's exactly the way we normally. The expectation is for them to resubmit a whole new one, aligning to the domain. Thanks, Rihanna.
And then other one is, do we need to have a poster and pamphlets, or can we just use pamphlets for the public health campaign?
Thank you. I'll take this one. So I mean, I think in expressing the info or showing you the information that was provided in this particular submission, again, just to emphasize that it's really up to you the way you deliver the information, but provided that the information is required, that is required in the behavioral statement, is quite clear in that poster or in that pamphlet. You can opt to do both. You can opt to do either a poster or a pamphlet, but the information that is required to show competence in relation to the behavioral statement must be there, irrespective of what your delivery method is. So often we find the poster is really beautiful and looks really creative, but the core information of what the behavioral statement requires is missing or lacking in that particular pamphlet. And commonly, it would be like lifestyle information, healthy habits, those kind of things. Core information that's related to the behavioral statement is missing. So yes, you can do any one you choose, but provided the information is there. Thank you.
And our final question, for academic or manufacturing interns, if the RP at the 400-hour site is unable to declare your 400 hours and complete the sectoral progress report, what do we do?
Tabang, are you going to take this one?
Uh, yes, although I'm trying to make sense. For academic manufacturing interns, if the RP at the 400-hour size is unable to declare your 400 hours and complete the sectoral progress report, what do we do? I'm not sure here if the challenge is with the RP doing the completing this online, or what will be preventing the RP from being able to do the declaration. I'm not sure what this question requires, because normally the RP or the pharmacist at the site where the intern is doing the 400 hours is expected to do this. Hence, the intern will be completing the activities under their supervision. So I'm not sure what is required. Maybe Adele, with your experience, maybe you might be understanding it better, or Rianda.
Yes, Tabang, sometimes when academic interns come, they said that the site where they worked their 400 hours, that pharmacist couldn't log in and have access to complete that sectoral progress report. Um, well, I don't know if it's sometimes I just ask the pharmacist then to give me the report as the tutor, um, give me a letter, and then I go and declare it for them. But I don't know if council, if they can, I don't know. Usually I have had that experience once, only once, and then I just asked the pharmacist to give me um, an affidavit with all the information, and I did that as the tutor. I declared that.
Okay, thank you for that. It is noted. I will take the message to pre-reg department. Maybe there's something that needs to be done on the website to grant the supervising pharmacist the rights to upload. So I will take that message to the pre-reg department. Thank you.
Metabang, if I may.
Oh, Mekamo, thank you.
No worries. Okay, so we've developed a system such that the supervising pharmacist is able to submit the progress reports online. So how it works, and I think we've provided the training manual to the tutors at the academic institutions. So how it works, the supervising pharmacist will submit the progress reports, but they would not they would complete the progress reports, but they would not submit. And the tutor at the academic institution would then review the progress reports, and if all is good, then they submit the progress reports.
Okay, thank you, May. I think it's now clear. Now clear, thank you. And in the absence of any other question, we will look at the way forward. And as we do in the way forward, please note that there is a link that has been shared on chats. Please complete that attendance register or survey. Even if you don't want to participate in the survey to help us improve, just complete your names there and your PIN number, since this will be used as proof of attendance. And as our way forward, we want to, we're saying that interns should ensure that the entry is checked against the assessment criteria outlined in the portfolio of evidence guidelines. So interns must go and check on page 35 and 36 of the intern and tutor manual for 2026. The assessment criteria is provided there. And before they submit their entries, please make sure that you check if you have addressed everything required in each of the 4 steps of the portfolio of evidence that you are to submit, just to make sure that you meet the requirement. And secondly, when making a resubmission, in case your entry was assessed unsuccessful, it is important to carefully review and address the feedback provided by assessor and moderators. So sometimes interns, they make their resubmission without addressing the comments from the assessors and moderators. And this, it won't change the assessment feedback. The fact that you have made a resubmission and without addressing the comments, you will still be unsuccessful. So we're making an appeal to the interns to make sure that when they receive the results, they look at the comments and they discuss them with their tutors so that they can be advised on what is it that is required for them to be successful. So it is very important to make sure that is done because this is one of the area that we are seeing interns making resubmission without addressing uh, the comments provided. So I think if interns can make sure that they align their submissions with the assessment criteria and they address the comments from assessors, that will assist them in being successful. And when we go on to the next slide, is here we are just announcing our fourth National Pharmacy Conference. I hope you are all aware of it. So this conference is going to take place it's going to take place on the 11th to the 13th of October 2026 at the Durban ICC, and all interns are invited to attend. More details are provided in our website, and there is the early bird registration which is closing on the 31st of May 2026. Please don't miss that because it comes with a big discount, and we are looking forward to see you in the fourth national conference, pharmacy conference in Durban. And that's all from our side. And then we thank you, interns, for being with us. And we also want to thank the tutors who made time to join so that they can have a better understanding of what is it that their interns need to do. And I hope that will allow you to guide them accordingly. And I also want to thank the team that was here to facilitate the workshop. We appreciate your time to share with interns your assessment experience. I hope they have learned a lot and they will be able to improve the quality of the entries that they're submitting. And I also want to thank the team from the office for all the preparations. And with those few words, I wish you all the best with your day and goodbye.
Goodbye, everyone.
Bye.
Bye bye.